So today we're going to discuss about dysmenorrhea. Then they call them dysmenorrhea. So dysmenorrhea, in a simple term, definition means painful menstruation. Yes, most ladies they always get pain. Most ladies they get pain when their menses is about to start or when their menses don't start. So now a lot of people they dey worried because most time their major concern na say if dem go get issues with infertility. But in most cases, maybe the thing you no go cause infertility. Okay. Now, then get two type of this dysmenorrhea, which is this painful menstruation. Then get the primary type, then get the secondary type. But before this thing happen, before I discuss about the primary or secondary type, make I explain why it dey happen. Now, every month, every lady dey release egg. So when the egg no dey fertilized by any sperm, the egg go somehow shed off and die. Then also the womb naturally God do am such a way that e go help dey prepare himself for baby in case the fertilization occurs. Then the fertilized egg will now go and implant in the womb and start developing and start growing as a baby. So God do am such a way that the womb will start getting ready for this implantation for the baby to come. Now, if the baby doesn't come, some hormones in our body go come go help begin scrape the lining of this our abdomen. And how e take dey happen na say e go cause your womb go begin dey contract. Okay, e go dey contract. So in the process of that contraction, e go dey shade the surface of that your womb, now leading to that bleeding wey you dey see every month. Yes, that's how the thing happen. But now some people normally when something like that dey contract, e suppose get pain. But some people dey get prolonged pain. Okay, and some of their own pain they dey very extensive, they dey much. So that is when we now come with that dysmenorrhea, which is a painful menstruation. Now, as I said, we usually have two types: the primary menstruation and second. Primary is like the first time is occurring, and this one is very common. Understand? In such a way that it happens to maybe if you're seeing your menses for the first time, they call them menarche. Okay, you're seeing your menses for the first time. Then immediately after you saw your menses, maybe you start experiencing it 6 months, 1 year. Some people they reach up to 2 years before they go begin to experience pain. That is after their first menses. Okay. Now this one, most of the time, no medical condition they are associated with them. Nothing at all they cause them. It's just a normal process. Your body is trying to pick up. Then over time, as you keep getting older, the thing would adjust. Your body will start getting used to that pain. After some time, it will clear. But now, secondary dysmenorrhea. Now, those are when we say in your normal first stage of life, when your menses started, your menarche started, your first menses started, you didn't have any pain. Everything was going. But towards your 20s, 30s, you started experiencing severe pain. Very, very severe pain. Okay? When we say you know feel bear them again, that's what they call secondary dysmenorrhea. And most time then they get underlying conditions, medical conditions, when they cause them. Some of them will tell you say na fibroid. Yes, fibroid fit cause them. Then get another one they call endometriosis fit cause them. So there are a lot of things when fit cause them. Okay, and those things now based on say your doctor go examine you, or you do some abdominal scan when go identify, or you do some particular test when go identify see you get the underlying condition. But most of the time, once you start experiencing pains from your 20s up to your 30s, initially from the first time you started, you don't get any pain. There's usually an underlying condition. So, and most time you need to go hospital so the doctor will see you. Now, there are symptoms that usually present when you get the dysmenorrhea. One of the commonest symptoms are cramp. You will complain of pain, pain within your lower part of your abdomen. Yes. And the pain usually present maybe some days before your menses or during your menstrual period. That's when you notice those cramps, serious abdominal cramps. And another symptom you will present with sometimes, you will feel like say you want vomit, nausea, then or you will vomit. Okay. Some people will tell you that they get blurring vision. Some will tell you that they feel dizzy. Some will tell you that they get pain when they go radiate to the back. So these are the symptoms that usually present with. But one of the most commonest symptoms they present is that you usually have abdominal cramps, pains around your abdomen. Then It can be treated. If it is for primary dysmenorrhea, which I told you that you don't get any on the most of the time, you don't get any underlying condition that over time they grow above the symptoms will just clear. Understand? Which you need now just to use pain relief drug like an analgesic drug, maybe paracetamol, diclofenac. These are things you can use. It will help clear, stop the pain. But if you and you experience that kind of thing, that means you need to go hospital, make doctor examine you, when they do you some test, and also when they check if you get any underlying condition. So it's normal most time for younger people, especially if you're seeing it for the first time and you start having those pain. Over time, it should clear. So thank you guys. God bless you.